So what are some key areas of preventive care that we should be aware of and be able to discuss with our doctor?
Well, it starts with the basics like a balanced diet, regular exercise, and getting enough sleep.
Okay.
But it also includes things like managing stress, staying up to date on vaccinations, and getting regular checkups and screenings.
Okay. Those are all good things to know.
Mm-hmm.
What if I want to talk to my doctor about my family health history? Are there specific phrases I can use to bring that up?
Definitely. You can say something like, heart disease runs in my family. Are there any specific screenings you'd recommend? Or, my mother had breast cancer. Should I be getting mammograms earlier than usual? Being open about your family history can really help the doctor assess your risk and recommend those preventative measures.
Right. So it's like being proactive about our health and staying ahead of the curve.
Exactly.
Now let's talk about those tricky health systems.
Oh, yeah.
I imagine they could be kind of a nightmare to navigate, especially in a new language.
You're not wrong. Healthcare systems can be so complex, but we're going to break it down.
Okay, good, because I need a roadmap.
All right, so let's start with the different types of healthcare providers you might encounter.
Okay, I'm ready to learn about all the players in this game.
All right, so first you have your primary care physician, or PCP.
Okay.
This is your go-to doctor for general health concerns, routine checkups, and referrals to specialists.
So they're kind of like the quarterback of the healthcare team.
Exactly. And then you have specialists who focus on specific areas of medicine.
Okay, so if I'm having heart problems, I'd see a cardiologist.
Exactly. You also might have dentists, optometrists, all those kinds of healthcare professionals.
It's helpful to know who's who.
It really is.
What are those urgent care clinics that I hear so much about? When would I go to one of those versus a regular doctor's office or a hospital?
Yeah, urgent care clinics are great for things that need attention right away but aren't life-threatening.
Okay.
Like sprains, minor cuts, the flu. If you're not sure where to go, you can always call your doctor's office for guidance.
So they're like a safety net for those in-between situations.
Exactly. And of course, if it's a real emergency, you would go straight to the ER.
Okay, that makes sense. Now let's say I need to find a new doctor. Any tips for navigating that process in English?
If you have insurance, start by checking your plan's network to see which doctors are covered.
So it's like having a VIP list.
Exactly. You can also ask for recommendations from friends or family.
Okay.
Or even your current doctor if you're switching to a new one.
Right, those are all great resources. Once I've found a few potential doctors, what are some things I should consider when making that final decision?
Think about location office hours and whether they're accepting new patients. You might also want to check if they have any online reviews or ratings.
So it's kind of like shopping for any other service.
Yeah.
You want to make sure it's the right fit.
Exactly.
Now let's talk about the elephant in the room. Healthcare costs.
Oh, okay.
It's something that can be intimidating in any language.
It can be.
What are some key things to understand and be able to talk about in English?
If you have insurance, make sure you understand your copay, your deductible, and your out-of-pocket maximum.
Okay, all of those terms can sound like a foreign language to themselves.
They really can.
Can you break those down for us?
Sure. So a copay is a fixed amount you pay for a visit.
Okay.
A deductible is the amount you have to pay before your insurance starts covering things.
Okay.
And your out-of-pocket maximum is the most you'll have to pay in a year.
Okay, so those are all really important numbers to keep in mind. What if I don't have insurance, though? Are there any resources that can help me manage the costs?
Yeah. Don't be afraid to ask about payment plans or a sliding scale fee based on your income. You can also check if there are community health centers or free clinics in your area.
That's good to know there are options available. Okay, let's shift gears now and talk about medical records.
All right.
What are some key things to understand and be able to talk about with our healthcare providers?
Your medical records have your whole health history in them.
Okay.
Past illnesses, medications, test results. It's important to understand who has access to them.
Right.
And how to get copies if you need them.
So it's like a detailed health journal that follows you throughout your life.
Exactly. And with more and more electronic health records or EHRs, it's easier than ever to keep track of that information.
Okay, EHRs. I've heard that term, but can you break it down a little bit?
Yeah, EHRs are basically digital versions of your paper records.
Okay.
And they can be shared between providers, which is really helpful if you see multiple doctors.
Right, so it can streamline communication and make sure everyone's on the same page.
Exactly. Now let's talk about something really important. Your rights as a patient.
Okay, yes, because this can feel tricky to navigate, especially in a new language.
It can.
What are some things that we should be aware of?
Well, first and foremost, you have the right to be treated with respect and dignity.
Okay.
You also have the right to ask questions.
Okay.
To get clear information about your condition and treatment options.
Got it.
And to refuse any treatment that you don't want.
So it's about being an active participant in my healthcare,
Absolutely.
making sure my voice is heard.
Exactly. Don't be afraid to speak up if you have any concerns or disagree with something.
Okay.
You can always ask for a second opinion from another doctor if you're not sure about a diagnosis or a treatment plan.
That's incredibly empowering to know that we have a say.
Yeah, and if you ever feel like your rights are being violated or you're not being treated fairly,
Yeah.
you can contact a patient advocate or file a complaint.
Wow. Okay, I'm already feeling more confident. Just knowing my rights and how to advocate for myself.
It can make a big difference.
You really can. And I guess it all comes back to that clear communication.
Yeah,
Being able to use our English to express ourselves effectively.
absolutely. Don't hesitate to ask for clarification. Use simple language and repeat information back to make sure you understand it.
Okay, you've given us so much valuable information already. Now, what about follow-up care? What are some key things to understand and be able to communicate about in English?
Well, follow-up care is all about staying on top of your health after you've seen the doctor. It might involve taking your medication as prescribed, going to follow-up appointments, or making those lifestyle changes.
So it's about continuing the conversation even after you leave the doctor's office.
Exactly. And if you have any questions or concerns between appointments, just reach out to your doctor's office.
Okay.
You can also keep a journal of your symptoms or your progress to share with the doctor on your next visit.
That's a good idea. Okay, I'm starting to feel like I can handle just about any healthcare situation that comes my way.
That's great to hear. And remember, clear communication is key to navigating it all.
Yes.
Don't be afraid to ask questions.
Right.
Use simple language
Yeah?
and advocate for yourself.
You've given us so much valuable information already.
Yeah.
But I know there are still some practical tips and strategies that can help us put all this knowledge into action.
Right.
So what are some things we can do to really make healthy habits a part of our daily lives?
Okay, well, let's start with something that we all know is important, but can be a struggle.
Yeah.
A balanced diet.
Oh, the dreaded balance.
Tell me right.
I know it's good for me, but sometimes it just feels so overwhelming. What are some practical tips for making it a reality?
I think one of the best things you can do is meal planning. If you take some time each week to plan out your meals, it can make healthy eating a lot easier.
So it's like having a roadmap for my meals throughout the week.
Exactly. And when you're planning, try to include a variety of fruits and vegetables, whole grains, and lean protein sources.
Okay, makes sense. But what about those days when I'm just too busy to cook?
That's where meal prepping comes in. You can cook a big batch of something healthy on the weekend and then portion it out for lunches or dinners during the week.
Oh, that's a great time-saving tip. I'm definitely going to try that. Now, what about eating out? I know it's not always the healthiest option, but sometimes it's unavoidable.
Right.
Any tips for navigating restaurant menus in English and making those healthier choices?
Absolutely. Don't be afraid to ask questions about the menu or request substitutions, like you can ask if a dish can be grilled instead of fried or if they can hold the sauce. You can also ask for a side salad or vegetables instead of fries.
Those were all good suggestions. I feel much more empowered now to make those healthier choices, even when I'm not the one cooking. Now let's talk about exercise. We know it's good for us, but how do we make it a regular part of our lives?
Well, I think the key is to find an activity that you actually enjoy. If you hate running, don't force yourself to do it.
Right.
Explore different things, swimming, dancing, hiking, or even just taking a brisk walk in the park.
Yeah, I love that. The idea of making it fun.
It should be fun.
It shouldn't feel like a chore. What if I'm not sure where to start?
Oh, there are so many resources.
Yeah.
You can join a gym, take a class, or even just follow a workout video at home. You can find free workout videos online on YouTube.
Okay, great. I'm already feeling motivated. Okay, what about sleep? We know it's important, but how can we actually improve our sleep habits?
I think establishing a regular sleep routine is really key.
Okay.
Try to go to bed and wake up around the same time every day, even on the weekends.
Easier said than done,
It is.
especially with our busy schedules.
Okay.
What are some other tips for getting a good night's sleep?
You can create a relaxing bedtime routine. Maybe take a warm bath, read a book, listen to some calming music, and really try to avoid screen time at least an hour before bed.
Okay, I know I'm definitely guilty of scrolling through my phone right before bed. What about stress? We've talked about the impact it can have on our health, but how do we manage it effectively?
Mindfulness and meditation are incredibly helpful.
Right.
Even just taking a few minutes to do some deep breathing can make a huge difference.
I've heard so much about mindfulness and meditation, but I'm honestly not sure where to start.
There are so many great apps and online resources these days.
Okay.
You can also find local classes or groups.
Good to know. What about just managing stress in those everyday moments when things just get overwhelming?
Yeah, just taking a few minutes to step away from the situation and do something relaxing can help.
Okay.
Maybe go for a walk, listen to music, take some deep breaths.
I love those suggestions. It's about finding those little moments of calm throughout the day.
Exactly. And remember, taking care of your mental health is just as important as your physical health.
Yeah.
So don't hesitate to reach out for professional help if you're struggling.
That is a really important reminder. It's okay to ask for help, and it's a sign of strength, not weakness.
Absolutely. Now let's talk about something else that's crucial for staying healthy. Vaccinations.
Vaccinations. Such an important topic, but I know they can be confusing.
It can be.
What are some key things to understand and be able to talk about with our healthcare providers?
Well, it's important to stay up to date on the recommended vaccinations for your age and health status.
Okay.
You can ask your doctor which ones are recommended for you and when you should get them.
Okay.
Don't be shy about asking about the benefits and risks of any vaccine.
Got it.
And make sure you understand the vaccination schedule.
Okay. All good things to know. What if I have concerns about a particular vaccine? Is it okay to voice those concerns?
Oh, absolutely. It's your right to ask questions and express any concerns you have. Your doctor can give you evidence-based information and help you make an informed choice.
I love that. It's about having that open and honest conversation.
It really is.
With our healthcare providers. Okay, let's shift gears now and talk about those regular health checkups that we hear so much about.
All right.
Checkups. I know they're important, but sometimes it's hard to make them a priority.
I get.
What are some key things to understand and talk about with our healthcare providers?
It's good to know what screenings are recommended for your age and your risk factors.
Okay.
You can ask your doctor which tests you need and when you should get them.
Makes sense.
Yeah.
What if I'm kind of nervous about a particular test or screening?
It's okay to talk about it. Your doctor can explain the procedure, answer your questions, and hopefully make you feel more comfortable.
I really appreciate that reminder. It's all about that open communication.
Yeah, it really is important. And, speaking of staying on top of things, what about just keeping track of all these medical terms we've been talking about? I know it can be overwhelming.
Oh my gosh, absolutely.
Yeah.
My notebook is like overflowing with new words and phrases. How can we make sure all this information sticks?
I think repetition is key. The more you use those words and phrases, the more comfortable you're going to become.
Yeah.
So try using them in conversations with friends.
Right.
Or even just writing them down in a journal.
So it's like practicing any new language you have to immerse yourself.
Exactly. And don't be afraid to look things up. If you hear a word you don't understand, just jot it down.
Yeah.
And look it up later. You can use a dictionary online translator.
Right.
Even just ask your doctor.
I love that. I'm such a big believer in curiosity. If you don't know something, find out.
Exactly.
What about those moments when we just feel stuck?
Yeah. Yeah.
Or overwhelmed?
Mm-hmm.
It's easy to get discouraged when you're learning a new language.
It is.
Especially when it comes to something as important as healthcare.
Absolutely. You got to be kind to yourself.
Yeah.
Remember that everybody learns at their